Imagine this. A routine lab report lands on a doctor's desk. But, it's not routine at all. It is a massive red flag, a serious alarm bell ringing in the data. This one piece of paper, it's about to launch a high-stakes medical investigation. And today, we are going to follow the clues right from the very beginning.
Okay, so here's our first clue. The complete blood count, or CBC. You can see right away, everything is in the red. The report shows that every major cell line, we're talking red blood cells, white blood cells, and platelets, the whole shebang has just dropped to dangerously low levels. This condition, this finding, is called pancytopenia. And it's not a disease itself, not at all. Think of it as a system-wide alarm screaming that something is critically wrong.
So, with this report in hand, the clock is officially ticking. The doctor has to become a detective. This lab report is the first lead in a super complex case, and the central question is just staring them right in the face. Where do you possibly start when the entire system seems to be failing?
Well, the very first step for our detective isn't to solve the whole mystery at once. Nope. It's all about triage. It's about figuring out the immediate danger and assessing just how urgent this situation really is.
So let's just lock this term in our heads. Pancytopenia. It's simply the lab finding that all three of those blood cell lines are low. It's a distress signal from the body. And the cause? Well, it could be anything from a simple vitamin deficiency all the way to a complete shutdown of the body's blood cell factory, the bone marrow.
Okay, so this is where those numbers become really real. A low absolute neutrophil count, or ANC, means the body's main infection fighters are just gone. It leaves the patient totally defenseless. And if the platelets, which help you clot, drop below 20, wow, there's a serious risk of spontaneous bleeding. These are the red flags that demand immediate action, way before you've even solved the final mystery.
All right, so once the immediate dangers are managed, our detective can kind of take a breath and look a little closer at the numbers, because that CBC, it isn't just a list of low values, it's a pattern. And that pattern holds the first big clue to what's really going on under the hood.
And here it is. This is the first major fork in the road for our investigation, and it all comes down to something called the MCV, which is really just a measure of the average size of the red blood cells. If the cells are too big, that's a high MCV, our detective immediately starts thinking about nutritional stuff, like a B12 or folate deficiency. But if the cells are a normal size, the list of suspects changes completely.
But numbers on a page can only tell you so much. To get a real sense of the crime scene, you have to look at the evidence directly. And the single most important early clue in this whole investigation comes from putting a single drop of blood on a slide and looking at it under a microscope.
This, my friends, is where you can find the smoking gun. I mean, if the pathologist sees blasts, those are immature white blood cells, then bam, the diagnosis is very likely acute leukemia. Or if they see these funny-looking hypersegmented neutrophils, it's a massive clue pointing straight towards a B12 or folate problem. Each of these findings can just dramatically narrow the whole investigation.
So all the clues we've gathered so far lead our detective to one central question. Is this a production problem? Is the bone marrow factory failing to make the cells? Or are the cells being made just fine, only to be destroyed or lost out on the street in the bloodstream?
So how do you answer that big question? Well, you do it with this key test. Reticulocytes are brand new baby red blood cells that have just been released from the bone marrow factory. So by counting them, you can directly measure how well that factory is responding to the crisis.
And the interpretation is actually pretty simple. If the reticulocyte count is low, the factory is failing. It's a production problem, plain and simple. But if that count is high, it means the factory is working overtime, desperately trying to pump out cells to replace ones that are being lost or destroyed somewhere else.
Okay, so now our detective has a working theory. It's either production or destruction. So what's next? It's time to cast a wider net. They're going to run a series of tests designed to quickly rule in or rule out the most common and, really importantly, the most reversible causes. Think of this as the detective's first round of interviews with all the usual suspects. They check for common culprits, nutritional deficiencies like B12, viruses that can shut down the marrow, or even medications that have these hidden side effects. They'll even check the spleen, which can sometimes go rogue and start trapping and destroying perfectly healthy blood cells. The goal here is to find a simple answer and solve the case before you have to resort to more drastic measures.
But sometimes all these tests come back negative. The mystery remains. The trail goes cold. And when that happens, the investigation has to go directly to the source. It's time to get a look inside the factory itself with a bone marrow biopsy.
To see how this all really comes together, let's look at two classic cases. First up, a really common scenario, the nutritional culprit.
Okay, just look at how the clues line up perfectly here. The MCV is high, telling us the red cells are too big. The peripheral smear shows those classic hypersegmented neutrophils we talked about. The reticulocyte count is low, confirming it's a production problem. And then the final nail in the coffin, the B12 level comes back low. Case closed.
So the final diagnosis is megaloblastic anemia due to B12 deficiency. It's a production problem, absolutely, but crucially, it's a reversible one. You simply give the patient the missing B12 and the factory gets right back online.
All right, now for our second case, which is a much more serious situation. This isn't a factory with a supply chain issue. This is a case of total factory failure.
Here, the clues tell a completely different story. The MCV is normal. The reticulocyte count is critically low, again pointing to a production problem. But the smear is just empty. There are no weird-looking cells, just a real scarcity of all cells. The final definitive piece of evidence comes from the bone marrow biopsy, which is found to be hypocellular, which basically means it's empty, mostly replaced by fat. The factory has literally shut down.
The verdict here is aplastic anemia, and this is a much more severe diagnosis. It often requires some really advanced treatments like immunosuppressive therapy or even a stem cell transplant to try and get that factory working again.
So let's recap the detective's playbook. Step 1, confirm and triage. Look for those immediate dangers. Step 2, examine the key clues from the smear and the RIT count right away. Step 3, search for all the common culprits. Step 4, if you find a reversible cause, treat it. And only if the mystery persists, only then do you move to the final step, the bone marrow biopsy.
And here it is, your take-home checklist. These are the absolute must-do steps in this whole diagnostic journey. You confirm the numbers, you get that smear and retic count done early, you screen for the easy reversible stuff, you always watch for those red flags, and you know when it's time to go look at the marrow itself.
Which brings us to our final thought. You know, when you see this entire diagnostic process laid out, from a single scary lab report all the way to a definitive answer, you kind of have to wonder, right? What's more amazing? The incredible, mind-boggling complexity of our own biology and all the ways it can go wrong, or the beautiful, elegant logic of the detective work we've created to solve the case?